With the number of coronavirus cases in the U.S. increasing day by day, so does a possible threat to the nation's blood supply. To help us understand the potential blood shortages and how we can help is Gail McGovern, CEO and President of the American Red Cross. She joins us now from Washington, D.C. Thank you so much for being with us, Gail. We know that the coronavirus has forced thousands of blood drives to cancel here in the United States. So talk about what the overall impact has then been on blood donations.
Well, first of all, thank you so much for having me on the show to get the word out. We do a lot of blood drives at businesses, at college campuses, churches, and as you know, these institutions are shutting down, and so we are facing a shortage. About 5,000 blood drives have been canceled, and that equates to about 170,000 units of blood. And we are scrambling to get blood drives back on our books. We're asking people if they're healthy to come donate blood. We're urging them to come out because we don't want to see a blood shortage on top of the coronavirus crisis. So we don't want another health crisis on top of this one.
Yes, certainly. I want to hear from you what you're hearing from doctors and from hospitals across this country regarding their blood supply, and talk about how the non-coronavirus patients are now being impacted by the shortage.
Well, I'm sure all of your viewers know someone that got a blood transfusion at some point. We need them for chemotherapy patients, for trauma patients, for a person who had open heart surgery and the like. And each of these kinds of surgeries require blood. And we've told the hospitals, please postpone all elective surgery, and they're doing that. So we're providing about 75% of their orders. And with the elective surgery off the table, we're still facing a shortage.
Yeah.
And I can't even imagine what the hospitals will go through if a doctor has to make a decision which critical patient is going to get the next unit of blood.
Yeah,
so
we don't want it to get to that point, certainly. I know we've all been talking a lot about social distancing, physical distancing, but you say that should not affect people who can and would like to donate blood. Can you talk about why you wouldn't be affected? Because people are afraid to go out, they're afraid to stand in any kind of a line. So talk about what precautions have been put in place.
Well, we put a lot of safety precautions in place. First of all, every person that presents to donate, we're taking their temperature. We're having the staff take their own temperature every day. After each donation, we're wiping down the bed. We have the donors use hand sanitizer before, during, and after the donation. We're keeping the beds as far apart as possible. We're trying to keep people in line as far apart from each other as possible. We're spacing out the donations so we don't get a lot of people coming in at once. We're doing everything we possibly can to make it a safe environment.
All right, yeah, an important note to anyone who wants to help. This is how you can help. Your local hospital needs your blood, and they are making it safe for you to do so. Gail McGovern, thanks so much for joining us today. We appreciate it.
Can I add one more thing?
Sure, of course.
Love them to go to our website and make an appointment. And if they want to sponsor a blood drive, they can do that on our website as well. We have a wonderful app they can download and make appointments through that, or they can call our 800 number, which is 1-800-RED Cross.
All right, so many ways to help. Gail, thanks again. We are wishing you the very best.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.